Hi, this is Dr. Michael Fitzmaurice. I'm the founder and CEO of the Fitzmaurice Hand Institute. And today we're going to talk about carpal tunnel syndrome. And we're going to focus on the symptoms, anatomy, and how we diagnose this condition. So the symptoms here, you can have pain in the wrist located here with this marker. You can also have numbness and tingling in the fingers. And typically this is the thumb, index, and middle finger distribution. Some of the other symptoms, though, can even be pain up the arm, even into the neck and shoulder. And this is often confused with neck issues when it may, in fact, come from a problem in the wrist, such as carpal tunnel syndrome. So if we take a look at a wrist here and we draw a line through it and we look towards the fingers, we're going to take a look at the anatomy of the carpal tunnel. And this is formed by wrist bones here on the bottom, and there's a ligament on the top. And so this forms a closed structure. Inside the structure is flexor tendons and the median nerve. And there's a pressure of low pressure, about 5 millimeters or less. And patients with carpal tunnel syndrome have inflammation in the carpal tunnel. And what this does is increase the pressure beyond a cutoff value of 30 millimeters, at which point they have symptoms. And this can also lead to blood supply to the median nerve getting cut off. And if we look here, there's also a thickness of the carpal ligament, which reduces the compliance and further increases the pressure. This causes an increased size of the median nerve, which can be visualized on ultrasound for diagnosis. These symptoms can occur then, such as numbness, pain, weakness, even atrophy of the muscles. So if we take a look here at the pressure, we'll see a normal pressure in the range of 5 millimeters or less. And these are normal patients. They don't have any signs and symptoms of carpal tunnel. When you have carpal tunnel syndrome, this pressure is elevated beyond a cutoff value of 30 millimeters at which they start to have symptoms. Now, postoperatively, if patients need surgery, once you release the ligament, this pressure is reduced down to a normal level. Compression of the median nerve is visualized here, and normal blood flow is the top one, and then compression and disease can decrease the blood flow to the nerves. The problem with this is this can actually lead to permanent nerve damage if this is not corrected. Now, the diagnosis of carpal tunnel syndrome can be made with a proper history. There's a few clinical examination techniques which can pick this up, but we also confirm this with several examinations, including nerve studies and ultrasound examination. I'm going to go over the difference here. Nerve study is a test where you can see the distance between point A and point B and measure this distance and see how fast the nerve takes to travel. This can give an idea of a damage to the nerve fibers. This is painful. It's expensive. It's not good at detecting early carpal tunnel syndrome. It's time consuming and delays treatment. And what we mean by that is it requires a visit to perform the test and then another visit to review the results. Now, ultrasound, on the other hand, doesn't have any pain associated with it. It's less expensive than nerve studies. It can detect early nerve studies, early carpal tunnel syndrome, even when nerve studies are normal. And it can detect abnormal anatomy. And a test can be done and reviewed all at the initial visit. So you don't have this back and forth and delay and going to various appointments. So ultrasound of the nerve looks like this, where it's nice and round here on the top of a normal, and on the bottom we see this enlarged cross-sectional area consistent with carpal tunnel syndrome. And on the right here you see why. There's a congestion of the nerve fiber that causes this increased size. Now, what are some risk factors? So increased weight, age, there's smoking, drinking, trauma, and there's all kinds of medical conditions such as rheumatoid arthritis, diabetes, hypertension, hypothyroidism. You don't have to have any of these. These are all certainly risk factors. A lot of times we can't find one particular cause for carpal tunnel syndrome. What about work activity? So increased risk of carpal tunnel syndrome if you have repetitive and forceful gripping activity. In particular, too, if you have a lot of flexion and extension of the wrist with work activities, this can certainly be a contributory factor, as well as vibratory tools. Some of the construction workers who use vibratory tools are certainly more prone to this condition. So for further information, you can visit us at fitzhand.com.